Stimulants such as Ritalin and Adderall are the traditional treatment for attention deficit disorder. For the most part, these drugs have been amazingly successful. They work by stimulating the central nervous system, throwing the body into the emergency energy system of flight, fight, or freeze. It is also known that they increase dopamine, and both of these dynamics tend to activate the prefrontal cortex. When that happens, I believe it also restores switched polarity. It is believed that the increased focus in the prefrontal cortex allows a person with ADHD to paradoxically calm down. Many times this is exactly what happens, but unfortunately there is a backbeat of anxiety and speediness that the body can experience in addition to the calm feeling. There are many possible side effects due to the stimulating effect amphetamines have on the central nervous system. At least 15% of those who try amphetamines have such severe side effects that they have to discontinue the medication. Because the body is thrown into fight, flight, or freeze mode due to the stimulants, many people experience temporary, if not permanent, appetite disturbance and significant weight loss. This is due to the simple fact that the body reacts to the stimulants as if its life is threatened. If we were in danger of being killed, we would not take the time to sit down and eat a meal. Therefore, nature has made sure that our appetite would be suppressed at those times. Luckily, most people are affected only for about a month and lose an average of 10 pounds before their appetite rebounds, although some simply continue to lose weight and the medication has to be discontinued. Most people with ADD, ADHD have always had difficulty with their sleep cycle. The typical pattern is difficulty turning the mind off at night and then trouble waking up in the morning. Using stimulant medication appropriately, such as amphetamines, is extremely difficult. Each person is different and may respond best to a particular kind of stimulant, a particular dose, and for a certain amount of time. This time period is usually between 4 to 5 hours for long-acting Adderall. I ask my clients to rate themselves on a 0 to 10 scale for feeling alert, focused, and relaxed. The sweet spot for the therapeutic window is between 8 to 10 on a 0 to 10 scale, which is exactly when the polarity point tests weak. The second dose has to be given exactly at 7.5 on that scale, or the result is often irritability, moodiness, and a resurgence of ADD symptoms. If a person has uncomfortable symptoms in the first 2.5 hours after taking a stimulant, that could be a side effect, or the dosage might be too high. If a person has uncomfortable symptoms when the medication is wearing off, that is not an indication of a side effect, but instead a timing problem, indicating that the second dose should have been taken earlier. Most people can only take 2 doses of extended release Adderall a day, and no stimulant can be taken safely after 4 p.m., as the chances for sleep disturbance would be too great. If a person is fortunate, 2 doses will be enough to work effectively until 8 p.m., and if this is the case, there usually is a lack of sleep disturbance. However, many times the medication wears off somewhere between 4 p.m. and 6 p.m., and ADD symptoms return, resulting in the characteristic sleep disturbance that most ADD people experience. Many people who use a stimulant in the morning often use AdCare in the late afternoon or evening, since it is a natural supplement and does not cause sleep disturbance. Another potential problem with the use of amphetamines comes from numerous studies suggesting that growth in young children is temporarily impeded or delayed by their use. This is usually resolved by going on a drug holiday for the summer. It certainly solves the growth problem, but usually means a difficult summer for both the child and the parents. One of my favorite sayings is there is never a reason to be without a prefrontal cortex, but there is no perfect solution for this particular problem when using a stimulant medication. The entire growth issue is moot when using AdCare, since the supplement does not affect growth and thereby allows the child to continue its use during the entire year. Some people have reported feeling a sense of intoxication or feeling high when they take amphetamines. In general, people who do not suffer from attention deficit disorder do become high on amphetamines, certainly act speedy, and if they take enough, will become addicted to the substances. However, those people who do have ADD generally do not experience this high, and instead have the characteristic paradoxical reaction of becoming calm and focused. They also do not generally become addicted. Addiction means increasing the dosage to get the same feeling and experiencing withdrawals when stopping the substance. As I mentioned before, this does not usually happen with ADD clients. Unfortunately, however, it is true that some people do become intoxicated, and good medication management should note the problem if it occurs and discontinue the medication. The more likely problem is that some people who were prescribed an amphetamine might then sell to others who do not have ADD. A number of people report feeling irritable on the stimulants. The problem could be that the dosage is too great and just needs to be decreased. Another possible reason for this problem is that one stimulant can cause irritability with someone, while another one would not have the same side effect. Remember that if the irritability occurs in the first couple of hours after taking a stimulant, it is indeed a side effect of the medication. If the irritability occurs in the last hour of the medication's effectiveness, that means another dose should have been taken earlier. Some people become very tired, moody, and irritable after the last dose of their stimulant wears off. This is an unfortunate situation, and if the feelings are too severe, the medication might need to be discontinued. A significant amount of people experience other irritating side effects, such as excessive sweating and bad breath. The amphetamines are officially listed as a narcotic, even though narcotics are really only opioids. Opioids are either natural or synthetic opium derivatives. But because of this, amphetamines cannot be called into the pharmacy, and instead have to be picked up at the doctor's office on a monthly basis. This can prove to be embarrassing and certainly is inconvenient. The cost of the amphetamines can also be rather overwhelming. Long-acting Adderall can cost as much as $450 a month if a person does not have medical insurance.